All right, thanks everyone for joining us. Today we have Kevin Capatch from Geisinger Health Systems and also Max Peoples, who is owner of two community pharmacists. He's a pharmacist himself, and he also is the owner of RxScan, which is a software product that supports DSCSA.
Thanks, Bob. Welcome everybody to the webinar. Geisinger is a rural health system in central Pennsylvania, so we have a very, very broad geographic region, and we tend to describe it as having three core legs, right? We have our healthcare leg, where we try to make better care easier for our patients throughout our care delivery area. And we have our research and School of Medicine, right, where we're an educator. We're trying to create the physicians of the future and make sure we're always current on how to deliver, exceptional care. But we're a little unique because we're also a payer, so it gives us a different perspective to have all three legs of those stools. But my role, I tend to sit in a very interesting spot where I get to support not only Geisinger's internal processes as a director of process engineering, but I also support work external in what we call industry standards work, so that we can try to create solutions to problems we have today that we want to prevent in the future. And I think that's what today's about, right?
So I am a pharmacist. I was actually the first pharmacist in Ohio to provide immunizations back in 1997. About that time, I also started a Coumadin clinic in my pharmacy. So I started offering a lot of clinical services. And so what's very important for me operationally is operational efficiency. What can we do to make sure that everything is as efficient as possible in the pharmacy?
Kevin, I just have one quick question. Geisinger, do you have inpatient and also outpatient pharmacy?
Yes, we also have retail pharmacies as well, Bob. So there's pharmacies that are in our clinics to make it convenient for the patients. Right after they've seen the physician, they can pick up the commonly prescribed meds before they leave. It saves them a trip to a pharmacy if needed. But we also have our inpatient delivery system in all of our hospitals. So, and we have a mail order business that we run.
From your perspectives, both of you, from a dispenser at the end of the supply chain, could you briefly explain what DSCSA is to you and to folks that perform your roles?
To me, what DSCSA is an opportunity to work on an industry problem. Nobody argues with patient safety, right? You can get people pretty homogenous pretty quickly when you talk about patient safety. And pharmacies always had the 5 rights. You've got to have the right patient, you've got to have the right med, the right route, the right delivery, the right drug, and the right dose. And that's ubiquitous. I don't think anybody argues with that. But unfortunately, there's a known problem in the pharmaceutical supply chain that we have illegitimate and suspect drugs that somehow infiltrate and become part of the flow. And what we're talking about today is, number one, how can we prevent that infiltration? But if we haven't prevented it, how can we detect it and make sure it doesn't get to the patient? So the FDA has created mandates that we need to work to as an industry, right? And it's global. It's a global problem. It's not just a local problem or a national problem.
And so I would just add that great description that from my perspective as, right before the patient, we need to make sure that the medications we get are actually the medications we think we are getting, right? That what's in there is actually the right effective drug. And DSCSA is about following the ownership change from manufacturer through all the distribution networks down to the dispenser to the final distribution point. And that you can actually see who all those different owners were and how those products traveled to help increase your assuredness that what you have is the real product. And then, of course, by having that trail, if there is problems, if things are found on the side of the road, there's a pickup truck that gets stopped along the highway and they open it up and there's drug containers in there, they now can start a chain of identifying the ownership history and how did it end up in that pickup truck. They can go to the manufacturer. Who did you sell it to? Manufacturer. You sold it to this distributor. Distributor, what'd you do? Well, I sold it to this other distributor. Okay, you go to that distributor. What'd you do? Oh, I sold it to this pharmacy. Now they're at that pharmacy saying, well, what did you do with it? Did you actually get it? Did you dispense it? Did you send it back? Was it recalled? What all? That's the kind of stuff that helps in a counterfeit investigation, try and figure out where did things go awry.
To me, the conversations have a different feel to them when we're talking about dispensers, because you are dealing with the patient, whereas a lot of the other hops, if you will, is supply chain, not patient care, actually. When did your organization start to prepare for DSCSA compliance, and how's that evolved? It started in 2013 when the law was enacted, and we've had a good 10-year run at it, at least.
Bob, it's interesting to have you as our kind of host and interviewer on this session, because it started with me picking up a phone and dialing a number that I was given and told that I needed to plug into the GS1 standards, and especially into the ePedigree conversations that were going on. And you were the voice I heard on the phone that day in 2009. So you were the start for me. Geisinger was actually involved in data standards a little bit prior to that. I don't know exactly when, but I know they were in some activities that predated that. But my entry point was that pedigree call. But I asked you, are we talking doc, D-O-C-K, or doc, D-O-C, meaning the doctor? And I asked that for a specific reason, right? Because there's two supply chains at play here. There's the external supply chain that's got to get it to my receiving doc. And then, as Max referred to, there's the internal supply chain that's got to get it from my doc to the patient safely. So we, as healthcare dispensers, providers, we have to manage both of those supply chains. But you answered and said, well, I guess, Kevin, great question, but we're talking DOCK. Wow, there's a lot of steps that go from the doc, DOCK, to the patient, right? That we do what the doctor wanted us to do. But, we obviously want to have trust with whatever we bring across our doc, that it's the safe and right medicine, because we want to get it to that patient as quickly as we can to make sure they begin their healing process.
So obviously, everything really started before the passage of the law in 2013. There was issues going on in California, issues going on in Florida, state regulations and so forth were being put in place. A lot of concern by other players, not necessarily at my level, the dispenser level, about meeting all these different regulations and so forth. If you're a distributor or manufacturer. So I was tangentially aware, and then obviously watched as the rules were being put together, the regulations were being passed in 2013. And so we really started then. Okay, what applies to us now? And have just as things kicked in and as they started to apply towards dispensers, then we started to apply. Obviously, the way things started out, dispensers didn't have a whole lot to worry about initially, the first few years and so forth. And then things start to kick in little stages. And then you start looking at your SOPs and do you have the things in place? Do you have the training in place, et cetera? As far as actually really tracking serialized products, we started scanning the 2D barcodes as they were coming available. And so we started really scanning October of 2017 in my pharmacy. So we had software solution in place. We knew what was supposed to be coming in, even though at that time there was no EPCIS documentation. So we were getting serialized information. That's what we're just now struggling right here for this November to finally get those documents.
And you mentioned the 2D barcodes as they started the first part of this of serializing product before the data even moved. Did that affect at all the pharmacists, that this new thing's on there?
It depends on which part of the dispenser side of things you really have scanning or not have scanning. And there's always been a difficulty in scanning NDC barcodes because our systems, our software, whether it's a pharmacy dispensing system, whether it's a EHR dispensing at the bedside and stuff, they all work off of the 11-digit NDC number. But by law, what's in the barcode, whether it's the 1D, the original linear barcodes, just a bunch of lines, or the new square ones, which are the 2D data matrix, they look like QR codes, but they're not actually. There's something slightly different called a 2D data matrix. But what by law is in there is the 10-digit NDC number. And that's actually how I got started in technology. It was crazy. It's in the 90s, and it was a big joke in pharmacy. You couldn't scan the barcodes and look up that drug in our pharmacy dispensing system. And it's very important. I want to document what NDC did this patient really get. And it's Medicaid fraud and Medicare fraud not to bill the 11-digit. On the billing side, it's 11-digit. On the FDA side, it's 10-digit. Okay? And so that's how I got into it. Developed a product called NDC Translator. So when the 2D barcodes started showing up, pharmacists would question, But if they didn't have a scanner, which requires a special scanner, it's got a camera in it, not the old linear laser line type of stuff, they couldn't read it anyways. So when those started showing up by law, a lot of pharmacies didn't have the right kind of barcode scanners. They were very expensive at that time. They're dirt cheap now. Until something really has a necessity in a lot of the dispenser world, like I got to really learn about something, I got to really see it. There's a curiosity, but if it doesn't directly affect me that day, it doesn't directly affect my patient care that day, it just goes past. Because pharmacies, at least community pharmacies, are under a lot of financial pressures. And so they're just trying to make sure they've got the right drug for the right patient and they can keep the door open. So everything about DSCSA, that's just another headache. It's another dollar expense that they haven't wanted to deal with until they really get forced into it. And now they're getting forced into it, even though a big chunk of the community pharmacy dispensers did get another period of time to be fully compliant. There's still a lot of DSCSA that they have to do today, such as validate your trading partners. That includes not only who you're buying from, but who you might be selling or loaning to. A lot of pharmacies do that, community pharmacies. Somebody's out of something that day, the patient needs it, they'll call up and say, hey, do you have some of this? Can I borrow it? Sure, no problem. Well, there's rules under DSCSA about that, just that process of what you're doing. Secondly, there's rules about making sure that the pharmacy you're going to loan to down the street still has a valid Board of Pharmacy license, right? So there are parts of DSCSA that are going on today that the recent FDA exemption did not exempt you from. And so pharmacies need to be aware of. There are things they have to do. They can't totally ignore DSCSA.
When about did you start to have conversations with those that were going to be touching either the data or the product in their day-to-day operations?
As different pieces of DSCSA kicked in and we need to be compliant, there was conversations there. And then in the early years, there wasn't a lot of materials out there. It wasn't like the national community pharmacy associations, whether they're hospital-based type of pharmacy associations or community pharmacies. They weren't spending a lot of time, if any time, on materials or sessions, webinars on DSCSA. It's really only been the last couple of years that they've really started to touch the subject. Truly, in 2023, a lot of community pharmacies were not concerned about DSCSA at all. But there wasn't enforcement. The boards of pharmacies weren't coming around. The FDA wasn't coming around. There was nobody looking over your shoulder saying, hey, are you doing this? You should be doing this right now under the regulations. You should be doing that under the regulations. So if nobody's checking you out and overseeing, then you've got lots on your plate. And so we just kind of didn't deal with it. And then as it got closer into 2023, and originally it seemed like, that the FDA was going to truly enforce the 2023 deadlines, then more and more were coming on board. Then, of course, they got the extension, and you had some people who just said, whoa, I'm going to wait. I'm going to take as much time as possible. And other people said, no, I'm just going to use this time to continue to move through the process and make sure that when November 2027 or 2024 comes along, I will be fully compliant.
Maybe we could talk a little bit about the kinds of technologies that you've had to implement over the years.
We actually started scanning at the bedside, so it had nothing to do with DSCSA, but it had everything to do with those 5 rights I was talking about earlier. So a lot of times, Bob, we were scanning the barcode that we were putting on the product because we can't dispense a 100-count bottle of pills to the patient. That's called an overdose. We have to get it into a unit dose, right? So we had internal technology that we needed to use to make sure that we put the right identification on that unit dose. So we had, label printers that could print a scannable barcode. We had packaging systems that allowed us to take the 100-count bottle and put it into a unit dose pack. And then we had to make sure that drug library was updated and current so that when we did scan it to administer it to the patient, it would confirm against what's typically called in pharmacy, the formulary. The technology that was in use at the receiving dock, and I hate to say it because it sounds primitive, but it was a number 2 pencil and a printer. Right? So somebody was printing out a packing slip that was shipped in from the prime distributor. And as the totes were opened up, somebody was checking off to make sure that what was on our order and what was confirmed to us in that packing slip actually came across our dock. And that's still probably a widely used technology today, to be honest with you. So DSCSA, for the first phase, what I call the first phase, the 2015 phase, I'd like to tell you that we implemented a full business system and we scanned every product that was coming across the dock and confirmed it, but we didn't. Right. And the reason we didn't is there was an exclusion in the law that allowed the prime wholesaler, if they got the product directly from the manufacturer, that information, what we referred to as the T3, the TI, the TS, and the TH, transaction information, statement, and history, right? There was no lot number if it was a direct purchase by the wholesaler from the manufacturer. So technically speaking, the information that we were receiving and the information on that paper packing slip looked almost identical, right? Other than that transaction statement. So we continued for the majority of our receipts to use the paper and pencil. So 95% of our drugs coming through that methodology left about 5% that we bought direct or in absolute urgent need might have bought through what's typically referred to as the secondary market or the gray market. But we were anti that methodology of supplying our patients. We tried to do everything in our power to make sure that we bought direct, what we called direct. So we did have a solution provider that offered a free service to store the information that was coming through. And whether it was with the lot information or without the lot information, it seemed like the main focus of 2015 was on the 6-year retention period that the FDA had mandated. So we made sure the data was in there. We made sure the data from our prime wholesaler was in there, but we were not verifying on receipt to any degree. And truth be told, we are just beginning those processes today, right, to get ready for the serialization because it's a game changer. That 2D barcode that Max talked about, yeah, you can scan it with your iPhone today, right, or your Droid phone. The ability to scan is no longer the challenge. The original challenge was there was nothing to scan, right? There was an NDC, it was linear, the 2D wasn't prevalent.
I think, again, we take a lot of look at operational efficiency and take a look at what's practical, what's affordable. Mm-hmm. And we said 6-year retention. I don't want boxes of stuff. I don't want microfiches of stuff. I don't want CDs of stuff. And so the minute we could start getting the advanced ship notices, which in tech term is the EDI 856 documentation electronically, because now you're storing everything as bits on hard drives. We started doing that. And that's, we started doing that early 2017, receiving that data in and storing it. And then that's why it allowed us in the fall of 2017, as the 2D barcode started showing up in larger numbers on the physical products, we can now actually tie the serialized information, lot expiration date, serial number G10, to a particular PO. We also get the invoices, so they're all tied together. So if we do a return, we know the PO number, the invoice number, they're all tied to that particular serial number NDC combination. So we started all of that with the perspective of we were a paper process on receiving, right? I mean, that's how the world lived for generations and decades. You get your order, hopefully there's a packing slip, you pull out the packing slip and you start sorting stuff, you start counting stuff, all very manual. Well, when you can operationally turn that into a scan process, it's more efficient, it's faster. If you're only checking in 1 or 2 products, there's an even trade-off, right? But when you got a lot of products, and a computerized system allows you to scan in any order. And you can scan not just prescription products, but OTC products. You can scan your whole order, and you can let the system match it up, right? It can now tell you, yeah, you got 12 of these, you got 6 of these. And now the final step is now, does the serial number on the physical product match the serial number in this EPCIS file that your supplier is sending you? Again, you're letting the computer, the software, do all of that eyeball work. I gain a lot of efficiencies just in receiving and making sure that I got what I'm paying for. But at the same time, that same scan gave me the ability to make sure that my EPCIS information, that serialized information, matched the physical product. And again, to remind everybody, why is that important? If I don't know that I have access to that serialized information, which the only way is to match the physical product against the file and know I actually have that, I can't give that product to a patient. Okay, that's just the law. I'm not allowed to use that product for a patient if I don't have access to that serialized information from my supplier. So our drive on our perspective, just operating my pharmacies, was how do I maximize my efficiency? How do I make this as easy as possible on the staff that's going to do this? Because most of this work is being done what? By pharmacy techs, by receiving technicians, materials management specialists. I want to make this as easy and as quick as for them, but then still have my reporting capabilities so that when somebody does come asking questions, I've got all the information and it's available quickly.
How did you approach training?
So what we did was basically take their current process and simply add scanning to it. So the training process, the switch, was minimal. Okay, we fit this inside of what they're already doing. They recognize the order, PO number, right? Okay, for this PO, here are my totes that belong to that PO. Now that's recognized by a barcode scan. In the old days, you'd open a tote, start marking things off on the packing slip. Now all you do is open the tote and scan. So it was just a slight modification to the workflow that they already have. The end result, if you do a time study, it is easier and it is faster.
There's a subcontext I need to share because there's a function in the purchasing system, right, that we were using at the time that allows you to do a receive all. So unfortunately, we took advantage of that, right? Because from a transaction standpoint, you do the edits. So you get the paper copy back with the number 2 pencil, and whatever they wrote in that you got that wasn't on the paperwork, whatever they didn't tick mark, then you went in and you edited the receiver and said, okay, this is what I got, this is what I didn't get. And if you wanted to keep the product that you got as an overshipment, you put a purchase order, line extension or quantity extension change order through. If you didn't get a product, obviously you began the customer service route that you would do to say, hey, you know what, I ordered, but I didn't receive, right? So that tick mark of that pencil in our process, because of the receive all function and what at the time was really our ERP system we were trying to, serve, was actually pretty easy to do with a pencil. But I've looked at Max's system and I've looked at other systems that are on the market today that do the scanning. And I would have to admit that if you wanted quality, right, if you wanted to actually make sure that the product that you got, especially when you get into the serialization, I don't think the tick mark is going to be as effective because you're going to have to spin the bottle to try to find that serial number. And now you've got to look not just for quantity. I've got 10 bottles. Now I need to say I have these 10 unique bottles, right? So I think the heyday's over. You're going to have to make the lift and shift to the scan everything model. And I think, there might be some aggregation we can take advantage of at some point in time when we have confidence that the supplier that aggregated things under SSCC or the secure supplier shipping code, right, that we trust that process that created that aggregation. We're heading towards the scanning world. You're no longer going to be able to avoid it. We've kind of shifted to where Max started. We're saying, well, if we're going to scan it, what else can we do with this scan? So, I mentioned formulary. That scan allows me to validate that it's in my clinical system, right? That it's in my drug library, it's in my formulary. It allows me to make sure it's in my billing system. It allows me to make sure that it's got an expiration date now that I can pick up in that 2D barcode. It can check a recall database upon that scan. So I don't even put it into the flow, right? Because it's on a recall. I can manage my par levels much tighter because I've got inventory on hand balances now that I can visualize and use. So we went light on the training. We only trained in the pilot areas. And hopefully that conservation of energy, we're going to be able to offset it because of the benefit that they're going to get when they start to scan. And our implementation plan has started, right? We are now rolling out to all of our pharmacies, all of our retail centers, all of our inpatient, outpatient. And it's going to come with a barcode scanner. It's time to get in the game. I agree with Max. I think the scan all is going to have the ability to make it faster and much more traceable, right? Because you're going to have evidence, you're going to have a timestamp associated with that scan, which could become very valuable when you start to do tracing.
What's your experiences dealing with the wholesalers and the manufacturers now that there are things that you need to comply with? And some of those things are dependent on the actions of the manufacturers and the wholesalers.
We're heavily relying on our solution provider to be our interpreter, right? We still speak EDI, we speak that ASN 856 every day, right? But we don't speak EPCIS in our Geisinger technology stack today.
It's still a struggle. There's really two parts to this. There's the data, right? Your suppliers, whether it's a distributor or whether it's a direct purchase from a manufacturer, they got to actually have the data and be sending it on. But there's a mechanism to send the data. And so that's a connection process. And so the first thing you have to do is actually get those connections set up. The EPCIS is typically sent through what's called an AS2 communication process, where you have to get that set up. So your solution provider, your organization, whoever the supplier of that product is, they need to set up those links. The more suppliers you have, the more links that you have to set up. I mean, we've been working with people for almost a year now. And so you get the connections finally set, and now we're waiting on the data to flow. And so like you may have a distributor that has multiple warehouses. Some of their warehouses is sending EPCIS data. Some of them is not. Okay. And you don't know if on any given day you don't get some data, is it because it wasn't sent or because they didn't have it for some of the products? I mean, you could have an order from that distributor and none of the products on that order, do they have information from the manufacturer of the product? That could be a reason why you didn't get it. It could be because there's a break in the connection. And I would just encourage everybody, communication is really important. Some of the suppliers are much better at communication than others are. If you have problem suppliers, tell your clients, whether it's the solution providers that you're working with or whether they're actually people that you're selling to, let them know what your issues are if you're having issues. It's not uncommon. I may send out a purchase order from one of my pharmacies, and it may actually get filled out of 3 different locations.
Oh, okay.
And so we'll get data out of one location and not the other 2. Okay. It's because they're in a ramp up process, to capture, to compile the data, to send the data out.
You must have to be very flexible in your operations and just how you're dealing with this as things sort of work their way out.
Everyone is supposed to have a suspect and illegitimate product investigation SOP in place. What do you do when you have a suspect product? You think there's something wrong with it. What is your policy that all your staff's supposed to be trained on and they know do X, Y, and Z? So now, how does this fit in theoretically come November 27th and you don't have data on this bottle?
Right.
What are you going to do? Now you got a patient out there who needs that bottle. They need that insulin. They need whatever it is. What are you going to do? It's 24, 48 hours, 72 hours or whatever before you could get a replacement. What are you going to do? And that needs to be part of your SOP. And my suggestion to folks is ask yourself a series of questions. Did you get it from your normal supplier for that product? Was the container it came in sealed? Did it come through the normal delivery service? Does it look like how you expect it to look? Okay. If you can answer yes to those kind of questions and document all of this,
right?
You've got to have a way to document all this. We've automated all that documentation because you need to keep that documentation for how long? Yell it out. 6 years. Okay. 6 years.
6 years, and it restarts if you have an investigation. So another 6 years on top of that.
Yeah, it seems like there's been a lot of emphasis of late on the SOPs, and people may not recognize that they need to be written and conformed to.
Yeah, I mean, we have a very good process when we get serious about the need for the documentation, right? So once we have a policy and procedure and it's vetted, there's an internal system, it's electronic. We got rid of the paper books, thank goodness. Right? We wrote draft policies and procedures that are sitting there waiting to be upgraded to work for the 2023 serialization law. So we've kicked off that campaign again because we've said, right, the game's up, right? You've got to start to scan product. You're going to have to start to realize that if you don't get that green light go, it's going to be red light quarantine. And you're going to have mechanisms in place to pursue getting that cleared. Or as Max stated, you might have to make some tough decisions, right? Do I dispense this product that has a questionable information trail? Nobody wants to compromise a pharmacist or a pharmacist's integrity, right? We want to give good medicine to patients every day.
I don't expect that you've had any FDA visits or anything like that, but State Board of Pharmacies are also involved in this. Have they asked for any DSCSA information over the years?
There's this part of the law that says about filing a 3911, which is the FDA report if you suspect the drug, right? Or you've performed the suspect investigation and you've now determined illegitimate, you're supposed to file a 3911. And I asked the Geisinger team at that time, like, Geisinger's a 1915 organization, right? So we'd been in business for a while, and I asked the question, right? Have we ever filed a 3911? The answer was no, right? So you've got an organization that understands what a 3911 is, but they've never filed one. And I've asked that question in other forums, and it turns out that we're not alone. If you've never filed a 3911, if you take a step back, then that probably means you've never really concluded that the drug that's in your possession is suspect or illegitimate. So when you talk about dispensing a drug where you don't quite have all the information matching up to the physical product, that may sound worse than it is.
Okay.
Right? And I think that's a context that we could let get exaggerated, and that's going to cause people to probably put drugs into quarantines, and we may never get them out because that data stream can't be corrected. There's also another condition that makes it a little bit challenging. A manufacturer could file for a waiver and exemption, just like we can file for a waiver and exemption. But there's no published list of where those waivers and exemptions sit. So if you detect that the drug is on a waiver and exemption, you're going to have to log it in your database, and you're going to have to log when it expires. So that at some point in time, you may not be able to use that waiver and exemption exclusion anymore to keep advancing the drug. So this gets way more complex than what it's been for the last 10 years.
The Ohio Board of Pharmacy, because my pharmacies are based in Ohio, they've been proactive, trying to stay on top of DSCSA. They've attended some of the PDG, Partnership for DSCSA governance meetings. So in regards to boards of pharmacy, they're one of the most active. And they did actually ask to come out and see it in operation, our system in operation. And a couple of the inspectors came out to our Essentra location and was actually able to see first person. Okay, look at the shelves.
Okay.
See the receiving process. See what's getting documented. See how the quarantine process is documented. Because they just wanted to learn. This wasn't about an inspection of a pharmacy. They wanted to learn. They've expressed that for this first year, they will be going around to pharmacies, but they're coming from the perspective of education. Where are you at? What are you doing? This is what we expect, but from a real educational process to try and not, smack people down, but just help them along.
I don't think there's anybody, manufacturer, wholesaler, solution provider, dispenser, that feels that we've got this all completely figured out at this point in time. But I will tell you this, the energy level has not waned. If anything, it's increased. And people are working very diligently to try to get these systems ready because we get it, right? If it doesn't match, there's a patient at risk, and that's not the goal, right? We don't want to take good drugs and not be able to dispense them. We want to prevent, as I said earlier, infiltration into the system, and we want to increase the ability to detect and remove the drugs that should not be in the system. That's the goal, right? If we keep our eye on the ball and the goal, we'll get there, right? Because it's a worthy goal.
And I would throw in, it actually does work. Earlier this year, very much earlier this year, we were able to identify a situation that was doubtful. And so I was able to call the DSCSA representative for the manufacturer of this product. 24 hours later, I'm in a call with their counterfeit division. 24 hours later, they're talking to the distributor that was involved with this particular product that was doubtful. 24 hours after that, everything was getting shut down. So the system does work. This did, because of the extra communication, because of the extra data flow, it was possible to identify a suspect situation. And when everybody got looking into it and investigating, it definitely was. I just say to everybody, bear with it. There will be gains in the long run. It just takes a while to get to them.
There are two other functionalities, verifying product information and tracing. Can you talk a little bit about those two processes? And I guess one area that I would tease out here is that how they're different than the passing information between adjacent trading partners.
Well, let's start with product identity verification, PI verification. And this is written into the law. The minute you have a suspect product, you got that bottle and it goes, I'll hide the name here. Something looks wrong, right? You're supposed to contact the manufacturer and ask them very simply, manufacturer, did you make a product with this NDC lot expiration date and serial number? Yes or no? Now the question is, how are you going to do that? Find a phone number, find a website, have a solution that can do that communication computer to computer. If you're going to do a computer to computer, remember a lot of scamming and stuff going on out there. You got to make sure that the two computers that are talking to each other are actually truly talking to who they say they are. You know, one of the ways it's done that is they use this thing called credentials. The two computers each have a credential and they pass them back and forth. Because remember, typically my pharmacy doesn't have a direct relationship, business to business with a Lilly or Pfizer or Merck, right?
Right.
So if I'm reaching out to them, they have to verify. Now, who are you? Are you who you say you are? So whether you're doing it on the phone, you're doing it by email, there has to be a process of back and forth. If you're doing it computer to computer, you got to have a process to make sure that the parties are who they say they are. If my computer system reaches out to Lily's computer system, did I get to Lily's computer system? Those kind of things have to be built into this process. So just understand that the law requires the minute you have a suspect product, I think there's something wrong with this, you got to ask the manufacturer. Now, unfortunately, currently right now, it's just yes or no.
Right.
But over the last couple of years, it's finally people actually started talking about it. I mean, it's been in the law forever, but as people really start thinking about the application of this, the actually doing this and so forth, they started to realize things, well, just to say, yes, I made it, but yet you know it's been reported stolen, or you know that it's been recalled, not to pass that information on would be crazy, right? So these are hidden benefits that will come. COVID, what did they do? They extended the expiration dates on a lot of products. Well, wouldn't it be nice as part of this product identity verification process, whether you could just ping them, ask them, hey, has the expiration date been extended or has it been shorted? So those kind of features are being built in, and people are saying in the next year or two, a lot of the manufacturers are saying they want to add that in. They want to do more than just yes or no. So product identity verification, suspect product, ask, did you make it, yes or no? If you have any doubts, just ask. And they have to have a reply. Now, how fast is the reply? It probably is going to be a lot slower without a computer-to-computer process. When you got to find a phone number or request something over an email, it's probably going to be slower than a lot of dispensers would like, right? Especially if you've got one bottle and the patient's here. You want the answer fast. Now, in regards to tracing, what's tracing really about? That's about telling somebody who has the rights to ask you, Board of Pharmacy, Police Department, FDA, FBI, some regulatory agency that has the right to request this information. What do you know about the ownership history? And so the first thing you need to be able to do is have the records and quickly. Now, there are times for some of these answers, like if they come in and ask you to see a copy of your SOP, you got to show it right now.
Right.
If they come in and ask you to give them a tracing, you've got 1 or 2 business days, depending on particular scenarios, to get that answer. And so when you're looking for solutions, consider how fast you're going to be able to come up with answers if they ask a question of like, who did you buy it from? Now, some of the tracing system is still being built for everybody, full disclosure out there, for the whole system to really be able to have some automated system and so forth. But do expect, and that's kind of where I started out with that example of a pickup truck gets stopped on the side of the road, and there's bottles in there and they want to do the tracing. So it's manual, right? They'll go to the manufacturer and say, manufacturer, who did you sell it to? They'll go to that party and say, who did you sell it to? And this is tracing, right? So you go into the distributor and they say, who did you buy this from? Who did you sell this to? And then they'll just keep going down the chain. This is all tracing, that ownership chain, until they get to the final. And this is where, just speaking as a pharmacist, as a dispenser, I do want to know for certain that I actually got that NDC number with that serial number. for two very important reasons. One, because I'm at the end of the chain and some distributor said, that's the serial number. I sent it to this pharmacy. And if in my case, we sent it to Uptown Pharmacy. If I didn't scan the product on inbound, I don't know for certain that they sent me that. So I could get involved in some investigation, which is not applicable to me because I truly didn't get that serial number. They actually sent that serial number off to some other pharmacy, but neither pharmacy checked, right? And so we don't really know. So just from a self-protection point of view, I think all dispensers should be doing everything they can to make sure that the serial numbers they got actually is what they got. The second reason is returns. If you commonly do returns to your suppliers, the suppliers are only allowed to take back a serial number that they sold you. In the old days, you bought some from this supplier, you bought some from that supplier, and it was easier to return your overstock to this particular supplier. So even though you didn't actually get this box or bottle from that guy, you bought enough, you could return it to him. Not anymore. They now, as part of this process, they know the serial numbers, theoretically, that they sold you. And the law says they can only take back serial numbers that they sold you. So if you didn't verify on the inbound of that serial number, and there was a mistake, you can't return it.
So you're stuck with it.
You're stuck with it. Again, good record keeping is good record keeping. But at the end of the day, there are some protect yourself reasons to do it.
Bob, I think when I envision the system up and operational, I see it definitely as a platform that can yield a lot more benefit than just what's required from the law to prove that you know the ownership of the drug and you clearly have possession of a drug that you can dispense, right? I mean, that's the baseline. That's the happy path that we want as many drugs on that happy path as we can. What Max was talking about is what I call the all play scenario, right? DSCSA only works if everybody's playing. Yeah. That scenario he talked about where, I don't think I'm going to scan and I don't think I'm going to scan. That's a dead trail when you do an investigation because you're going to know the last scan, but that last scan may not be the scan you need to prove that the drug stayed, within the proper chain. Right. We got to get a lot more people active in DSCSA to get the full benefit that Max just described. I don't doubt the benefits will be there, and I don't doubt the innovation will kick in and the things we've talked about doing. Because we'll say, hey, we've got this system now that we trust, right? We've worked really, really hard. We've built it. We've tested it. And that's typically what happens, right? When you start to develop systems. I'm sure the first railroad ride was a interesting experience, right? We're talking about building something that doesn't exist. Once it exists, then I hope the people that have been working on this that I've been associated with for over 15 years, we start using their brains to tap into doing things that we've never been able to do. This could lead to targeted recalls. Right now in the drug supply chain, it's not a targeted recall. It's a tell everybody. And not just tell Geisinger, but tell as many people in Geisinger as you can, which causes all of those people to report the recall. Which triggers separate investigations by all of those peoples until somebody says, oh, yeah, we already have that one in the system and we're already processing it through. That is not an effective and an efficient system. So you can think through this, as Max was talking about, and envision that being different, right? The drug never came to me, therefore I don't need to check for that drug. But the inbound, right? Getting that scan on the inbound that says, hey, this is on recall or this is expired, and checking the database to see if it's been extended or not, that could save valuable time. It's going to take everybody participating at some point in time to make this system truly secure, truly effective. And I think the more wins we have in those areas where we bring additional benefits other than just compliance, what we call the stick, right? And we actually bring some carrot. That's when people are going to get excited and interested and more participatory.
And the key to remember is this is us. This is our families. This is our neighbors, right? This is the kindergarten down the street, right? That we're all trying to protect.
And that's what I appreciate about having folks like yourselves from pharmacy, from hospital, because you have that patient-centric, everybody is in the supply chain. They realize that they're doing their part toward this, but it's hard to have the patient in mind when you're moving a case from here to here than when you know that Mrs. Jones is down the hall or she's standing in front of you, and you've seen her every day, and now you you have a different relationship and a different appreciation for what takes place to get that drug in front of you. Just to sort of wrap up, any pearls of wisdom or advice to your peers as they take on this mantle?
The one thing that was very apparent in one of the industry meetings we were at, somebody asked me after day one, what was the conclusion of day one? And I said, well, it was the Three Little Pigs story, right? It was we all the way home, because we were talking about waivers, exemptions, and exceptions, right? So the advice I'd have, I don't care where you're at in this journey, is get a waiver, exemption, and extension filed, right? Mm-hmm. Just get that protection in place for your organization. It's not an admission that you failed. The second piece of advice is get involved and get in the game. There's enough people on the road before you that you can learn from. You can jump on their hip and they'll help you, right? Mm-hmm. You're not going to have to start from scratch, but you are going to have to start. I don't think delaying at this moment in time any longer has any advantage to anybody. They need to start to, if they don't have a solution provider, they need to get engaged with a solution provider. But the last thing I want to say, and it's just a credit, Bob, to the industry, I've met some of the smartest people I've ever met working on this. And I feel like we're not using the brain trust effectively. They can solve bigger problems. We just need to get this one launched and out of our way. And then the real power is going to kick in on what we've built. We could solve drug shortages. You're theoretically going to have a system that knows the unique identification and the unique location of drugs. And if there were an epidemic or an urgent need to move or mobilize drugs to the right places where the most consumption is needed, we're no longer going to have what's called the beer truck game, right? The spikes in buying and the hoarding. Right. We would have the ability to direct drugs as a nation that's never been done before. Those are the things that make me not give up hope. The evolution will come, but we got to get started.
Max, from a community pharmacy perspective,
just remember, just because you have less than 25 employed pharmacists and pharmacy technicians, there are still many features of DSCSA that you have to be compliant with today. And if you don't have SOPs, get them done. Even if you don't actually have a full solution in place for the stuff as a dispenser you're required to be doing, get the process started. It's hard to come down too hard on you if you're doing something. If you're leaving your head in the sand, you're showing no effort, no progress, you're making it very easy for them to make an example out of you. Right. Don't be an example. Okay. Get something going. And you have to start. Just the process of getting you up and running on some solution takes time. And if you think you're going to get jumped to the front of the line at a distributor to get connection set up, when you've waited this long and there's, 10,000 people that signed up before you, you're in a world of hurt. So get your SOP in place, get something in process, sign up with a solution provider if that's the route you decide to go.
That's interesting. The writing smart SOPs, things that you can say you're actually doing versus what you're projecting. I really appreciate you both being here, giving your thoughts. It's been an interesting conversation. I hope people find this interesting as they review it.
Well, thank you. And thank OCI, the Open Credentialing Initiative, for putting this all together, organizing this, because credentials are a key part for some of this to be done electronically. And so for all of OCI's support, to the industry in as a whole, a lot of volunteer, for everybody to understand, there are tens of thousands of hours of pure volunteerism that has been putting all of this stuff together.
Yeah, that's for sure.
And Bob, to you personally, right? Since I've known you the longest on this journey, I know what you've done for this industry. And I think it just needs a special thank you, right, to you for being that steady voice that's helped us, continue these conversations, these hard conversations, and challenge people, right? That's okay. But let's move beyond the conversation to the solution. Thanks to Geisinger for giving me the privilege of having the ability to express my opinion. Honestly, it's a worthy cause.